go down here and then they'll show you where to park at now.
You want some sugar syrup too? Well, yes, honey. I'm going to leave my water right here. And you guys give anybody water that wants it.
Lean back.
I'm going to go get me some sugary syrup. I'll be right back.
Show us your numbers, please. 627, 628, 629, 630, 631, 632, 633.
Dustin Mullins. Yeah, I tried to make it last year and I couldn't make it, so I think my teeth is like beyond gone now.
Starting at the very front of the line, so they're going to need to have something in their stomach. So crackers, something not too sugary, please, because we are monitoring glucose levels. So just plain peanut butter crackers, cheese crackers, something like that.
My name's Danny Mother, and I'm 52. I can't go up. I ain't got the money to go get me no glasses.
Okay, help. This really helps people in this area and everywhere, you know. People just, they can't afford health care. Don't get me on politics. I just, I'll have to see it before I believe it.
People going to the dentist, go to the dentist lines. People going to the eye doctor, go to the eye doctor lines. We have general medicine, we call it, which is everything from mammograms and heart stuff and bones and cancer and that type of thing down at the far end. If you're here for that, you go to those lines.
Beverly Lanou. I got sick. I lost my job that I had for 20 years. Paid for the Cobra plan, and was, after I got sick again, I got a knock at the door, and they said my condition was pre-existing, and they would not cover any of my medical expenses. Lost everything I worked for.
Name any component of life, liberty, pursuit of happiness that you can enjoy, that we fought for wars and for years. How can you have that without health? If tomorrow we were bombed, no one would be fighting in Congress. How do we pay for it? We're at war, we will go. Why are we not at war then against disease? People need to look at this as public enemy number one. When you look at it like that, there is no choice but to say we should have health for all. Otherwise, what do we have a constitution for?
I know you are strong. There's nothing in you, Lord, all the day long. Though my friends forsake me and leave me alone.
Everybody lives on hope. If you don't have hope, what have you got?
Clouds with my Savior, my voice will shout His praise aloud. I'll join the singing, hear glad hearts ringing. When with my Lord I'll ride the cloud.
Over the next year, many of the biggest and most controversial parts of the Patient Protection and Affordable Care Act are going into effect. Ready or not, healthcare reform is happening, and it affects everyone in Louisiana, from Houma to Haynesville. You may not have had the chance to read it yet, or ever. After all, the law itself is just a couple of pages over War and Peace, or about 5 inches thick. Add up all the rules and regulations put out about healthcare reform, and you're looking at a stack of paper about a half-mile thick. You all right? So what are the major changes coming your way? There are a few things everyone needs to know to stay protected after healthcare reform. First of all, healthcare reform requires that each and every American buys health insurance starting in 2014. Yes, you too. If you don't buy health insurance, you'll pay a tax penalty to Uncle Sam. It won't be so bad the first time. It could be as little as $95 in 2014. But by 2016, you could pay as much as $695 for each uninsured adult in your family. Or by 2016, you could pay as much as $2,085 for your family. The good news is that many Americans will be able to get a subsidy or financial aid to help them pay for insurance. We'll tell you how to find out if you will get a subsidy at the end of this video, so stick with us. The second most important thing you need to know about healthcare reform is how it changes the kind of health insurance you can buy. Starting in 2014, almost every health insurance plan must include certain essential benefits, like preventive and wellness care, like annual checkups, tests, and immunizations at no out-of-pocket cost to you, emergency services, hospitalization, maternity care, mental health care, and others. These are great benefits for many people, but will drive up the cost of health insurance and take away choice from people who only want to carry very minimal and expensive insurance, usually young people or self-employed folks. There are some other changes to health insurance that are great for everyone. For example, insurance companies can't deny coverage to folks who have pre-existing illnesses or conditions, like a heart problem or diabetes. And young people can stay on their parents' insurance policies until they're 26. Businesses and employers need to know about their obligation to provide health coverage to their employees. Most businesses will be required to provide health insurance that costs their employees less than 9.5% of their annual income. If you're a business owner, your obligation to provide health insurance is determined by the number of full-time employees you have. These are just the basics. There is plenty more to know, but it all depends on your situation. No matter what, you have options when it comes to healthcare, and you need a plan. You can find out more at www.bcbsla.com/reform by clicking What are my options? Or Start Planning Now. You can also reach a Blue Cross agent at 1-800-223-9554 and get one-on-one help. Remember, healthcare is changing, but Blue Cross and Blue Shield of Louisiana has been watching out for Louisiana for the last 75 years, and we've got your back too. We're here when you need us.